Welcome everybody to NATF's Patient Pulse, an on-demand monthly educational webinar series. Today's webinar will focus on a common question that we hear from patients: what should I be eating to keep my heart healthy? We all know that there's a lot of mixed messages out there about what it really means to have a healthy diet. So we're thrilled to have Dr. Michelle O'Donoghue weigh in on this topic. Dr. O'Donoghue is a cardiologist at Brigham and Women's Hospital and an associate professor of medicine at Harvard Medical School. She is also a senior investigator for the TIMI Study Group, which is an academic research organization dedicated to studying heart disease and its risk factors. Some of her research interests include the management of acute coronary syndromes and heart attacks, heart disease in women, and of course, heart healthy eating. So thank you so much for being with us today, Dr. O'Donoghue. Take it away.
Great, and thank you for that kind introduction. So this topic is remarkably controversial, and part of the reason behind that, as we'll drill into, is that clinicians and healthcare workers are unfortunately just as confused as the rest of you about what constitutes an optimal diet. So I'll try to walk through the best science that we have available and leave you to draw your own conclusions based on what we know. These are my disclosures. So many of the facts are quite startling, and some of them you've probably heard before. We know that right now, as we think about the standard Western diet, that processed foods make close to 70% of the typical US diet, and that Americans spend 10% of their disposable income on fast food. It's also amazing to think that the average American consumes 130 pounds of sugar per year. So for many of us, that might be close to our body weight. And we also know that more than 1/3 of US adults are obese, so not just overweight, but also meet criteria for actual obesity. We also know that schools continue to be a challenge. Soda vending machines, sugary drinks, sugary snacks, many of these are widely prevalent at our schools today, and unfortunately might set the groundwork for future bad eating habits for some of our youth. So I'll start with the question: do we believe that heart disease is a food-borne illness? Well, we know that the prevalence of obesity has been skyrocketing over the past 35 years. This is a heat map looking at the prevalence of obesity in the US in 1985. And as we advance over time, you can see in 1994 that the prevalence is continuing to increase. And if we contrast that with today, look at now in 2010, let alone 2020, that the prevalence of obesity has really greatly increased over a span of just a few decades. We also know that obesity is an important contributor to diabetes. So when you look at these prevalence maps, not surprisingly, the hotspots for obesity also appear to correlate with diabetes. And as we think about the next step, well, is heart disease a food-borne illness? Perhaps not surprisingly, we also see that the prevalence of heart disease is quite concentrated in the same areas where we have a lot of obesity and a lot of diabetes. So I'll pose a question: if we believe that diet contributes to heart disease, why are clinicians and healthcare workers largely reluctant to believe that diet can meaningfully help to treat heart disease? I'm sure many of you have had that experience where you've gone to see your doctor, perhaps you have heart disease or at risk for heart disease, and asking how much can diet help. And a lot of times, I think doctors, unfortunately, are just shrugging their shoulders because they're unsure of the answer. Well, why is that? Well, the headlines are confusing. As you're aware, there are studies that come out almost every day. You can't turn on the news without hearing some sort of conflicting report. One day fatty food is bad for you, one day fatty food is good for you. Are eggs good? Are eggs bad? Should I be high carb, low carb, high fat, low fat? In short, there's just a lot of confusion. And because there's so little nutritional education within medical school, really doctors are shrugging their shoulders as well. And I think that there are many who just say, well, it's just too confusing. It's better to just steer away from the topic altogether. And this is highlighted in a New York Times article a few years ago that basically said that some medical experts say the problems with these lifestyle studies are so overwhelming, and the chance of finding anything reproducible and meaningful is so small that it might be best to just give up on those questions altogether. But is that really the solution? Well, no doubt that there are challenges with trying to figure out the association between foods we eat and the risk of cardiovascular disease or other types of bad health consequences. And part of the reason is because we know that people who eat healthy foods might also have a variety of other healthy lifestyles that might be independently contributing to having better outcomes. So it's hard to know whether it's the food per se, or whether or not it's something to do with the rest of the way they're living their lives. And just to highlight this point is the challenge of correlation versus causation. Basically, if somebody eats a lot of eggs and they appear to have a lower risk of heart disease, is that really related to the eggs themselves? So somewhat amusing just to highlight this point are a couple of graphs that show you how correlation between two factors might be likely completely unrelated. So this figure is showing you a correlation between the divorce rate in Maine and the per capita consumption of margarine. If you were just looking at this graph, you might think to yourself, wow, there really is a relationship between the two. But we know that that's just something that's just throwing us off. Similarly, if you look at per capita cheese consumption and the correlation between the number of people who died by becoming tangled in their bed sheets, look again how closely those two curves overlap. So you can see that the challenge exists with some of these studies with really trying to disentangle whether or not a particular food group is helpful or hurtful. So I'll lead off with some interesting observational studies, though, that have been conducted. This was a 20-year study looking some data from the China study, and this was published in a book. And basically, it was a 20-year study that was conducted by Cornell and by Oxford University across 65 counties in China. And the key takeaway points were that in rural China, the fat intake was less than half the fat intake in the United States, and fiber intake was 3 times higher. Animal protein intake, including dairy, was very low, so remarkably less than 10% of the US intake. Total cholesterol was much lower in rural China than in the US. And then when you looked at heart disease mortality, we saw that it was strikingly higher in the United States than in rural China. In contrast, though, when they looked at Chinese cities that had a more Western diet, those in contrast did have a higher rate of heart disease. So it was just a beautiful observational study that was conducted over a long period of time. And because there's relatively little migration within China, it was helpful for being able to really look at different eating habits and the risk of developing different diseases, such as heart disease. Here's another observational study that looked at the association between animal and plant protein intake with all-cause and cause-specific mortality. And if you look at the bottom of the slide, you can see the conclusions. High animal protein intake was positively associated with mortality, so suggesting that higher animal protein intake put you at higher risk of death. Whereas in contrast, high plant protein intake was inversely associated with mortality, so appeared to be more protective. Well, what about carbs? There are a lot of observational studies suggesting that intake of plants is better. But what about higher intake of carbohydrates? Well, it becomes challenging again to disentangle. Can we basically group all carbohydrates together? So if you think about what constitutes a carbohydrate, well, it could be whole wheat pasta, whole wheat breads, or it can be refined grains, or even carbohydrates would even include processed foods such as soda drinks. So you can see that there are challenges with trying to group all carbohydrates together in this type of study. Well, this particular study caught a lot of attention at the time, and it was controversial. It was across 18 countries and 5 continents, and it was called the PURE study. And what it suggested was that high carbohydrate intake was associated with higher risk of total mortality, whereas total fat and individual types of fat were related to lower total mortality. However, again, all carbohydrates were considered equal. And so part of the challenge of conducting this type of study across many countries was that the poorer countries that were known to have worse outcomes from heart disease were included, and those particular countries had increased poor quality carbohydrate intake. So in short, the feeling was that there might be some design flaws with this type of study that led to conclusions that we can't necessarily rely upon. Similarly, now I'm flipping to a new study that subsequently showed the opposite, showing that lower carbohydrate dietary patterns with high animal intake were associated with higher mortality, whereas plant-derived protein and fat intake was associated with lower mortality. So again, just to highlight the challenges of these types of observational studies. So really, in the end, the randomized trial evidence is what we consider to be most robust. So I'll lead off with that. I think that with the randomized trials, the beauty of it is that you have a comparator group. So it's not just looking at lifestyle choices for a particular patient, but really trying to challenge a patient to adopt a particular lifestyle. So the first study here that I'll highlight was the DASH group, or the DASH trial. And they took 459 patients who had high blood pressure and randomized them to one of 3 diets for 8 weeks. And the salt content was similar across the trials. And in short, a diet that was richer in fruits and vegetables and lower in fat and cholesterol appeared to reduce blood pressure over just this 1 to 2 month period of time. So really quite striking. You can see that over the first couple of weeks, there was a fairly marked drop in the systolic blood pressure and diastolic blood pressure that rivals many of the best blood pressure medications that we currently have available. So I'll also just show results from the Dean Ornish randomized diet trial. So here it was very interesting. They took 48 patients who were followed for 5 years, and they did coronary angiograms. So basically they went up invasively to take a look to see if those patients had blockages. And these were patients with angina. And they did this at baseline, year 1, and year 5. And they randomized people to having an intensive lifestyle change. So basically switching to primarily a vegetarian diet, exercise, smoking cessation, a lot of different interventions were performed along the way, as compared to patients who were just conducted with usual care. And the findings were really quite notable. Up until this point, there hadn't really been the feeling that we could change the severity of a blockage. So let's say a patient has a 60% blockage in their coronary artery. Our feeling had been that, well, with medications, we might be able to stabilize that and prevent it from getting worse. But I think the game changer here with this Ornish trial was that it suggested that the intervention group actually had a drop in the percent stenosis, so in the percent blockage that was seen. So you can see that here with the green bars, suggesting that diet can actually lead to regression of coronary artery disease. There was also a 90% reduction in the frequency of angina after year 1, and a 72% reduction after 5 years for patients who were in the intervention group. So again, quite remarkable, and a suggestion that there was a hazard in terms of higher risk of cardiovascular events for patients who were in the control group as opposed to those who were randomized to the interventions. This slide also nicely highlights, this is just a particular case study, but this was an individual who was actually a heart surgeon at the Cleveland Clinic, who was found to have a blockage in one of his coronary arteries. So you can see that in the panel on the left, the LAD being the most important artery that we have in the heart to supply blood, and showing that that area was very diseased and blocked up with cholesterol. And after adopting a plant-based diet, when they did a repeat coronary angiogram 3 years later, you can see that that disease had really dissolved away. So it's not to say that this happens for every patient, but there certainly are instances that have been described. Here's another randomized trial, the Lyon Diet Heart Study. 605 patients following a heart attack were randomized to a Mediterranean or Western diet for a period of 4 years. If you look at the Western diet with the green line, this is looking at the incidence of cardiac death or heart attack during the period of follow-up, and showing that patients who were on a Western diet had a markedly higher rate of cardiovascular events compared to those who followed a Mediterranean diet. The PREDIMED trial, this is another trial that looked at patients who were at risk for heart disease and randomized them to a Mediterranean diet, either enhanced with nuts or with extra virgin olive oil, compared to a control diet, and showed that there was a 30% reduction in cardiovascular events during the period of follow-up. If you look at a meta-analysis, so really a combination of all the randomized trials that have been published to date, looking at a variety of different comparison diets with red meat consumption. Basically, it has shown overall that substituting red meat with high-quality plant protein sources, but not with fish or low-quality carbohydrates, leads to more favorable changes in blood lipids and lipoproteins. Well, what about these low-carb diets that we hear about, where patients are largely taking fats and animal products? Well, the data there are quite mixed, but this is one randomized trial that took 30 patients and randomized them to a low-carb, high-fat diet versus just continuing their usual diet, and showed that on average, there was a 44% rise in LDL cholesterol, so that's bad cholesterol. Now, there was a widespread across individuals, but nonetheless quite striking that LDL cholesterol that we know to be bad seems to rise quite quickly within only 3 weeks on this particular diet type. This is another trial, a randomized trial looking at different types of what they call dietary portfolios, which is basically a primarily plant-based diet versus just patients taking a standard low saturated fat diet. And what the two graphs show, they're looking at LDL cholesterol as the outcome and showing that the plant-based diet had more profound effects on reducing LDL cholesterol as compared to just a standard recommended low saturated fat diet. So dropping LDL cholesterol by about 10 to 15%. Routine versus intensive just meant the frequency of follow-up. This is a study that came out of Alabama looking at the effects of a plant-based diet intervention on systolic blood pressure, diastolic blood pressure, again showing favorable effects, as well as the effects on total cholesterol and LDL cholesterol. One thing that was interesting with this particular intervention was that they also showed that there was a reduction in Lp(a). Previously, that had been a part of cholesterol that had been felt to be largely unmodifiable. So quite interesting that diet did appear to have an effect on that particular marker in this study. And here's another randomized trial, 100 patients who were randomized to either just the standard AHA, so the American Heart Association recommended diet, versus a vegan or plant-based diet, and showing that the vegan diet had a significant effect on lowering C-reactive protein, which is a marker of inflammation, which in turn we know appears to play a role in development of heart disease. So if we do believe that meat might play a role in the development of atherosclerosis or plaque buildup, what might be the pathway? Well, one idea that has been put forward is this idea of our gut microbiome. We know that there are a lot of bacteria that live in our gut and coexist with us, but sometimes different types of bacteria proliferate and may contribute to inflammation and other types of disease states. So there's a particular bacteria byproduct called TMAO that appears to contribute to inflammation and is known to be promoted by intake of meat. And there are additional studies, again, looking at the gut microbiome and suggesting that higher fat consumption leads to unfavorable changes in the gut microbiome, fecal metabolomic profiles, and plasma pro-inflammatory factors. That might just be one piece at play if we're trying to think about potential reasons why plants appear to benefit us more than animal products. So where do the recommendations and guidelines currently fall? Well, as you probably know, they're quite scattered, and a lot of doctors are still looking for more evidence before coming down with strict recommendations. But this was a commission put together by the Lancet, which is a leading medical journal. And this commission of individuals basically concluded that healthy diets have an appropriate caloric intake and consist of a diversity of plant-based foods, low amounts of animal source foods, unsaturated rather than saturated fats, and small amounts of refined grains, highly processed foods, and added sugars. Just a couple of months ago, there was in the New England Journal, which again is a leading journal, published an article about milk and health, and really sort of debunking some of our thoughts about dairy products and suggesting that for adults, the overall evidence does not support that high dairy consumption for reduction of fractures, which has been a primary justification for the current U.S. recommendations. and also potentially linking high consumption of dairy foods with the risk of prostate and possibly endometrial cancer. So our federal recommendations, well, the USDA recommendations have the Choose My Plate, as you can see here on the left. The Canadian recommendations have taken perhaps a somewhat more forward-thinking approach, where they're now adapting water as the drink of choice, and again, really trying to highlight intake of vegetables and fruits and whole grain foods preferentially over traditional high protein, animal-based protein foods. So with that, I'll just leave you with the thought that we should always consider to let food be thy medicine and medicine be thy food. And it's amazing that those words were first stated by Hippocrates more than a couple of hundred years ago. And yet I think that there is a lot of truth. We have a lot of wonderful medicines available, but nonetheless, I think that the body is often willing to heal itself, and foods can be an important component of any lifestyle modification strategy. So I'll leave you with those thoughts, and thank you for joining me today.
Thank you so much for that excellent review. We really appreciate your time. Just a quick question for you. For patients who want to start making a transition to a plant-based diet, what is an easy, doable way to start that?
Yeah, I think that for some patients, they've wanted to really dive in head first and adopt it all in one go. But I think that for those who are just sort of making those gradual transitions, it can be easier if you do it slowly over time. So first, by starting to dial up the amount of plant-based foods that you have on your plate, by thinking about those plate diagrams that I showed, trying to make sure that plants are really covering the most of your plate, and that the animal products are taking up a smaller and smaller fraction. So I think that for some people that really has been the best strategy. There are also a lot of great resources online.
Great. Thank you so much. And thank you everyone for listening. And you can join in again next month for another episode of Patient Pulse.